Cam?
Governor, just to clarify, for the movement into phase 3, does that include the city of Richmond and Northern Virginia, which are behind in their phase 2?
Great question. The question is, will Richmond and Northern Virginia move into phase 3 at the same time the rest of the Commonwealth? And until I hear differently, they will be moving forward. If they're not comfortable, Cam, if their numbers aren't to their satisfaction, then we'll certainly have that discussion. But to date, I haven't heard that they don't intend to be with the rest of the state. Jackie?
Oh, okay. Well, two things. So first of all, with the Department of Labor and Industry board, and within that department, is set to have a meeting tomorrow morning regarding some mandatory guidelines that many business groups have expressed frustration over, trying to figure out why there would be mandatory guidelines around social distancing, for example, now after weeks of recommendations. Can you speak to that, and do you have any recommendations for that board as they look to make a decision tomorrow?
I'm not sure if I completely understand your question, Jackie, but Dolly is having a meeting and looking at the guidelines so there's some businesses that may not be.
Yeah, so my understanding is that these would be mandatory after, for a long time, they've been more of recommendations. And there's been some uproar among business groups, to my understanding.
Okay.
Wondering why now to release these, and why would they be mandatory? So do you have any, can you just weigh in on that?
Sure. I'm going to let Dr. Healy come forward. Dr. Healy, thanks.
Thanks, Governor. The question is about the Safety and Health Codes Board that's meeting tomorrow. So in Executive Order 623, the Governor asked the Department of Labor to look at emergency temporary standards, and these are enforceable standards that can be temporary, and then it has to go through this board, even though the board is regulatory. So the Governor doesn't have oversight over this board, but he's asked for 4 things for Department of Labor to do, and that was around PPE in the workplace, sanitation, record keeping, as well as communication. So if an employee does have COVID-19, the employer must tell all the other employees that one person is infected, but not by name. And so there's been 10 days of public comment that ended on Monday. A lot of weigh-in from the business community about these particular standards. And so the board will meet tomorrow, and potentially if all these standards are passed, I hear there's amendments coming to the board. We'll find out tomorrow on Thursday that these standards would be posted online, and then they'll be enforceable by civil action.
But Governor, can you weigh in on whether or not you think that they should be mandatory at this point? Additional guidelines for businesses?
No, that was the whole purpose of making these guidelines. So yes, they will be.
But I'm sorry, can you speak to the criticism? What would you say to businesses who feel like this? Why now?
Well, I just, it takes a little while to get all of these guidelines in place. Like Megan said, we've had public input, and this is all about safety for individuals coming to our places of business. And I think, Jackie, I haven't mentioned this for a few conferences, but the key to our economic recovery is to know that businesses are safe, that it will be consumer driven. And so that was the whole idea behind doing this, so that we will have guidelines in place, so when people choose to go into a business venue, that they can feel comfortable that they're going to be safe there.
Amy Friedenberger with the Roanoke Times.
Hi, I just wanted to follow up about the nursing home data. The explanation that your administration provided about why the nursing home and assisted living facility information is being released now had to deal with the number of cases, and so could that mean that you could rescind what you're doing now as cases go down, or are you committed to, now that this information is made public, will you keep it public while COVID continues to be an active health threat? And will you commit to changing the code during the upcoming special session to codify this change that your administration just made?
Yes, Amy, thank you for the question. And as I said earlier, the reason that we made the decision that we made is because of a lot of misinformation that was coming out of Washington, certainly near your area in Roanoke. And so I have always said that the more transparency we have, the better, as long as we protect people's privacy. And the latter part of your question about the clarity in the code, and I've also been clear about that as well, that we do need more clarity, and we're having discussions with our legislators. We will have a special session probably in August, and whether it will be taken up during that special session or in the regular session in January, we haven't made that decision yet, but we'll certainly have that dialogue, and as soon as we have legislation that we feel will provide more clarity, then I will encourage the legislators to propose that. It will be vetted by different folks, and then hopefully bring more transparency to the process as we move forward.
Will you reconsider your administration's interpretation of the code in order to identify businesses with COVID outbreaks now that this exception has been made for the assisted living facilities?
Well, as I said, Amy, there's been no change in the code. This is in response to a lot of misinformation that was coming out of Washington, which was very confusing, and that's why the decision was made.
Following up on her question, I'm just wondering, now that VDH is releasing the names of nursing homes and assisted living facilities with COVID-19 outbreaks, I'm wondering if you'll be able to release the names of businesses like poultry plants with major outbreaks. And then my second question has...
Let's just stick with your first question first, if that's all right, Kate. It's all boils down to whether it's a public health risk, and so that's something that we will monitor moving forward. But the pandemic has changed. There are more nursing homes now that have had outbreaks, and so for the public health safety of individuals in these nursing homes, that's why the decision was made. As far as other businesses, we'll monitor that. If it becomes a public health risk, then it's something we'll address. But I think in also, and it goes along with what Amy asked, there needs to be more clarity. And so one of the things that this pandemic has done is it's brought out a lot of questions and different situations, and so we've learned, and we'll move forward and provide that clarity. So you had a second part.
Yeah, my second question has to do with reports on the dangers of use of chemical agents like tear gas and pepper spray during a respiratory pandemic, and we've seen those heavily deployed by law enforcement here in Richmond. So I'm wondering if that's a concern to you as a physician, and if you might, consider directing police not to use them.
Kate, obviously we don't like seeing the use of tear gas and rubber bullets. So no, I'm not going to direct the police how to do their work. But what I am going to say is that, we've had over 480 protests in the Commonwealth of Virginia. The great majority of them have been peaceful. And I just encourage Virginians as we move forward to keep their protests. I mean, that's a First Amendment right, but part of that is to be peaceful and not break the law. So we need people to abide by the law in the Commonwealth of Virginia. And obviously, the majority of these, that's what individuals have done. But as you saw last night in Richmond, an unlawful assembly was called a couple of times. People refuse to leave, and so when people break the law, we can't condone that. And so in order to keep the peace, the police are going to need to take the action that's necessary.
Bill Atkinson with the Progress Index.
Thank you, Marissa. Governor, has your administration reached out to the nursing homes about releasing this information, and are they on board with it? Because one of the main points they were saying so tight-lipped about this was because they were worried about losing their Medicare and Medicaid funding if that information got out. So what sort of feedback, if any, are you receiving from the nursing homes about releasing this information?
It's a good question. Do you want it, Laura?
Hi, the question's about whether we've gotten some feedback about the recent policy decisions around releasing the names. I have regular contact with stakeholders in the long-term care facility community. We meet regularly with their associations as well as representatives of individual facilities. We'll be scheduling a training on the new guidance and an opportunity to answer questions towards probably the tail end of this week. The information is already reported to the health department, so numbers of cases are already a reportable condition to the health department, so that knowledge is already known to VDH. Thanks.
If I can follow up real quick on that, is the information on the outbreaks at these nursing homes, is that available on the website right now, or when will that be available?
So available on the website right now is a list of long-term care facilities, nursing home and assisted living facilities that have had outbreaks of COVID-19. It includes the number of cases and the number of deaths in each facility. Very small numbers are suppressed in order to protect patient privacy.
So I just wanted a quick follow-up. Kate, I read your article, and I want to compliment you on the article. Just a lot of really good information in it. And one of the things that I wanted to remind all Virginians, a lot of us have loved ones in nursing homes and long-term care facilities. I have my 95-year-old father, and one of the questions that he asks is, when can you come visit me? And so I would encourage people to go to the website, which is actually part of your article. If they read your article, they can just highlight it, and it will direct them to that website, and it will outline the guidelines going into phase 3 on being able to visit our loved ones in the nursing home. So I appreciate your work.
Governor, you're announcing the move or the date for phase 3
Yes.
on a day when I think COVID deaths are at their highest in about 3 weeks. Do you see the daily death total as a, kind of a one-off, or are you expecting increases, but as long as the hospitals have capacity and all that, it's okay?
And Laura, are you referring to deaths in Virginia?
I believe so. Is that incorrect?
If you want.
So the question is, given that the deaths have increased, the reported deaths, are we being premature and going to phase 3? The important thing to realize when looking at that piece of information is that deaths are what we would call a lagging indicator. They occur, you get a case, a reported positive case, we know about that within days. Someone gets sick, spends a period of time in the hospital, perhaps in a nursing home, and then passes away. That gets recorded many weeks later. What's reported yesterday in terms of deaths reflects something that happened weeks and weeks ago. The more sensitive things to look at are the key measures that we've pointed to, like the test positivity, what's going on with the hospitalizations, and so on. And all of those key measures are trending down, as the governor said. And that's the important factor here.
Michelle Bash with WTOP.
Yes, Governor, are you prepared to roll back or slow down Virginia's reopening if a spike in cases starts here or if spikes continue in other states?
It's a great question, and I will use your question to remind Virginians that it is in all of our hands as we move forward. We all have a responsibility to continue the social distancing, the hand washing, not gathering in large groups. And if we can continue to do that, I think our numbers will continue to trend favorably. The question was, will we go back to phase 2 or phase 1 if we need to? Obviously, if we see surges in the Commonwealth and we're going in the wrong direction, then obviously we're going to have to make difficult decisions to do that. But one of the reasons that we are where we are today, and I would never have made this decision that I did, is if I weren't confident in our hospital capacity. They've done a wonderful job. As you remember, they stopped doing elective surgeries to really increase their PPE, their staffing, their ventilators, et cetera. So that has a lot to do with this. Also, the fact that we now have the testing capabilities. And we're in the ballpark every day of 10,000. I really anticipate that will increase, especially as we allow students to come back onto campuses. There's going to be, more testing, more prevalence testing out there. So that has ramped up every day to a point where I'm comfortable that we can look at different areas of Virginia by health district if we need to do more testing, if we see the numbers going up, that we have that ability. And then finally, the tracing we've been talking about every day is that we now have around 1,000 tracers. We will have more as we move forward. And so all of those things together allow us to be where we are today and to really try to open up our economy, get people back to work, and get back to that near normal. But I think the reality, and we need to remind ourselves, is that this virus is still out there. It is still very contagious. And as I said earlier, we need to take this very seriously. And if we don't, if we become complacent and don't continue to follow these guidelines, then the possibilities are there that we would have to go back. And I don't want to do that. I don't think anybody wants to do that.
Governor, we're getting a couple phone calls from folks in the funeral industry. These are directors and embalmers. They've been looking for PPE. They found some places that supply these items, but they're marked up quite a bit. And I know you've talked about having all of this available.
Yes.
And so they said they called some of the numbers on the website, but they haven't gotten calls back.
Okay.
Some of the numbers aren't functional. So just looking for some guidance there. And then also,
Let me just on that one, because I would encourage them, Andre, to go through their vendors. If they're unable to obtain the PPE that they need, to go through the local health districts and ask them for assistance, and then also through the local Department of Emergency Management. So any of those avenues would work. And then finally, we have what we call our VEST task force, and if they can't get the help they need, if they would get in touch with us, we would help them. We would direct them to where they can get help. But the bottom line is we have PPE, and if they're having difficulty obtaining that, we would certainly want to know about it. We want to help them.
okay. And secondly, if I may, a few conferences back, you mentioned that you would meet with protesters, but it wasn't time yet.
Uh-huh.
Now that we're seeing so much continued unrest, are you ready to meet with these protesters? And if so, what would you say to them as the governor?
Well, again, yes, I'd be more than willing to meet them. Obviously, we need to do it in a safe environment. And I would encourage them to continue to be peaceful and advocate and let us know what they intend to get out of all the protesting. I think, for the most part, Andre, I have listened, not face to face, but I listened to a lot of protesters. I recognize the pain. I know that the great majority of all of this, it started after the death of George Floyd because of the tremendous pain over the inequities, the 400 years of history, the things that we've talked about. So I'm more than willing to continue. And as you know, we've set up, are in the process of setting up listening tours across Virginia to really listen and address those inequities. But what I can't condone is the unlawful protesting. And the great majority, especially during the daytime, Andre, that we've witnessed, have been very peaceful. And we're all very supportive of that. But after the sun goes down, there seems to be a different agenda. And that's what I need to hear from these individuals. What do they want, and what we can do policy-wise to change a new path forward. I don't have my schedule in front of me, Andre, so I don't know when the different meetings have been set up, but they will be in the near future.
On the phone? Max Thornberry with the Northern Virginia Daily.
Yeah, I have a question about unemployment benefits and insurance. Is there any way for the Virginia Employment Commission to be able to track people that are refusing to go back to work because they're making more money on unemployment maybe they have been offered their job, but they aren't going back. Is there any way for the Employment Commission to track that other than relying on businesses and employees to self-report that?
Yes, we have been tracking that. Megan, you want to address that?
The question was around unemployment insurance and the people that have refused to go back to work, and if it's because of the additional benefits. We do not track that data. We know that around 12,000, I think it's 12,700 people have refused to go back to work, and they move through the adjudication appeals process that we cut their benefits. If someone lacks childcare or has a medical condition, then their appeals process is expedited, but we don't ask those specific questions of why they refuse to go back to work.
Good afternoon, Governor. Quick question on the release of the data for the nursing and long-term care facilities. Why not go ahead and also release the data for outbreaks at other facilities across the state, such as correctional institutions, behavioral health facilities, things like that?
Yeah, again, as I said earlier, if it becomes a public health issue, crisis, then we'll certainly look into that. But for right now, we've made the decision to release that information on our nursing homes. And again, not to be a broken record, but there remains lack of clarity in our code, and so we look forward to addressing that with our legislators.
Mel, last question. Hi, can you talk about the decision to close the Lee Monument grounds after
Yes.
the sunset? The ACLU, for example, said they felt that it was anti-free speech, and that just from being out there, it seems like the decision felt antagonizing to some of the protesters. So can you talk about the decision and if you are worried that it might yield more unrest?
Yeah, the question is about the Lee Monument and the little circle surrounding the Lee Monument. And, you know, Mel, I have been impressed that the majority of the gatherings around the Lee Monument during the daytime hours have been peaceful, and we encourage that. There was actually even, I believe, a wedding ceremony I saw a few days ago. But what I am worried about is after the sun goes down, when it seems to be a different crowd that comes to the Lee Monument area. And as I've said, that statue is 12 tons, and it becomes a safety issue. And we're responsible for what goes on in that circle. And so that's why I made the decision that I made, is that after the sun goes down, we encourage people to be peaceful and have their protests, have their gatherings during the daytime. But after the sun goes down, it becomes a liability, a safety issue. And so that's why I made the decision I made. And I would also say that it's unfortunate that this process is in the legal system. My intentions were to take that statue down a few days after I made the announcement, and because of the legal process, we've been unable to. But we're going to work through that process, and I'm confident that when we get through that the Lee Monument will be taken down. Thank you all very much, and we look forward to being with you on Thursday.